Hi, I'm Paula Hoffman, a licensed physical therapist and certified vestibular rehabilitation specialist with Penn Medicine, Princeton Medical Center, Princeton Rehabilitation. Today, I'm going to talk about vestibular disorders. While these disorders can affect individuals at any age, the inner ear degenerates over time, so older adults are at greater risk. If you frequently experience dizziness and a sense of being off balance, you can be suffering from a disorder affecting your vestibular system, which includes parts of the inner ear and brain that process sensory information involved with controlling balance and eye movements. The vestibular system includes the parts of the inner ear and brain that process sensory information involved with controlling balance and eye movements. The system contains specialized cells that detect movement along with crystals in the inner ear that help control balance. When the system is injured or damaged, it can lead to dizziness, vertigo, and balance problems. According to the Vestibular Disorders Association, more than 69 million adults in the United States have experienced some form of vestibular dysfunction. One of the most common vestibular disorders is benign paroxysmal positional vertigo, also known as BPPV, or more commonly, vertigo. While according to the Vestibular Disorders Association, BPPV often has no identifiable cause, in many cases it is related to head injury or advanced age. Other conditions that can affect vestibular system include bacterial or viral infections, ALS or Lou Gehrig's disease, multiple sclerosis, stroke, Parkinson's disease, migraines, Meniere's disease, a tear or defect in the thin membranes between the middle or inner ears, non-malignant tumors, and neck injuries. Symptoms of vestibular dysfunction may be mild, lasting only seconds or minutes, or they may be severe, causing problems with bathing, dressing, and simply getting around. And depending on the severity of the symptoms, the disorder can lead to falls, especially among older adults. Common symptoms of vestibular disorders include dizziness, a lightheaded, floating, or rocking sensation, vertigo, feeling as if your surroundings are spinning or whirling about, imbalance or unsteadiness, blurred or bouncing vision, nausea, hearing changes, lack of coordination, problems with concentration and memory, headaches and muscular aches in the neck and back, elevated sensitivity to noises and lights, extreme fatigue, depression, and anxiety. Not everyone with a vestibular disorder will experience the same symptoms, and activities that cause symptoms vary in each person. Most often, symptoms are brought on by certain head movements and positions, such as bending down to tie your shoes or rolling over to get out of bed. Occasionally, symptoms of vestibular disorders will resolve on their own, but if they persist or interfere with your daily life, it is time to see a doctor. Often, doctors will refer patients to physical therapists for further evaluation and rehabilitation. Depending on the cause, treatment of vestibular disorders may include medication, traditional physical therapy techniques, balance and gait training, visual tracking exercises, and instruction in activities of daily living. There are also lifestyle changes that may help relieve symptoms. For some people, avoiding certain foods, like those high in salt or sugar, as well as alcohol and caffeine, can help reduce episodes of vertigo. For others, symptoms can be aggravated by increased stress and lack of sleep. For patients with BPPV, a technique called the Epley maneuver can correct dizziness by repositioning the displaced crystals in the inner ear. The maneuver involves a series of sequential movements of the head with each position held for 30 to 60 seconds and is proven to be highly effective treatment for BPPV. At Princeton Rehabilitation, therapists with specialized training offer comprehensive testing and treatment for dizziness, vertigo, and loss of balance due to vestibular disorders, including teaching patients how to use the Epley maneuver to relieve symptoms. Prior to creating a treatment plan, patients go through a series of tests the use of infrared video goggles to assess eye movement and accurately diagnose BPPV. A referral from a physician is necessary before making an appointment for vestibular rehabilitation, and most insurance plans cover treatment. Feeling like your world is constantly spinning is no fun. If you suffer from dizziness or vertigo, ask your doctor about vestibular rehabilitation to make it stop so you can regain your balance and independence.